move my badungadungi. I move my badungadungi. Here. Yes. Here. Here it's me, myself, and I, and my new tail, and my badungadungi, and nightmare, and dude. I type a friggin' a lot.
Yes. Yes, you did.
And I do not know if we're gonna read everything. It depends of nightmare because, dude, I do not gonna read it.
I'll read it.
I'm not gonna read it because my dyslexic guys can't do medical English.
Oh.
So yeah.
I can.
Okay, let's the first slider. Hold up. How do?
Yeah, bring it up.
Yes, it's there now. Look at that. Fancy as Ehlers-Danlos syndrome and the ribbon. This is the Ehlers-Danlos syndrome ribbon. It's black and white because the zebra is the Ehlers-Danlos syndrome mask. Now you can start here. Look, overview, nightmare.
Okay. So, overview of EDS. Ehlers-Danlos syndrome is a group of inherited disorders that affect your connective tissues, primarily your skin, joints, blood vessel walls. Connective tissue is a complex mixture of proteins and other substances that provide strength and elasticity to the underlying structures in your body. People who have EDS, Ehlers-Danlos, usually have overly flexible joints and stretchy, fragile skin. This can be a problem if you have a wound that requires stitches, because the skin often isn't strong enough to hold them. Yeah, I remember when doctors have given you stitches and...
Yeah, bro, last time when I got stitches, I have an X shape of a scar on my arm because they put stitches there and it didn't healing it properly, and yeah, now I have... Bro, I want a tattoo put in there, so I'm gonna have a treasure map and the X gonna be in the treasure mark, you know? That will be awesome!
A more severe form of the disorder, called vascular Ehlers-Danlos syndrome, can cause the walls of your blood vessels, intestines, or uterus to rupture. Because vascular Ehlers-Danlos syndrome can have serious potential complications in pregnancy, you may want to talk to a genetic counselor before starting a family.
And also, a side note, I do not specific know what type of Ehlers-Danlos syndrome I have. They be marked me as an hypermobility. How you say that? Hyper.
Yeah, but that's the only one that Finland recognizes.
Yeah, that's the main point. That's only what you can have in Finland. At this point, because in Finland, this illness, hypermobility, yes, that's only what you can have in Finland. They doesn't really do more research if you get EDS. Diagnosis is gonna be automatically the hypermobility EDS. So for me, it's
it's almost impossible to get proper treatment because they don't even recognize your disease properly.
Yeah, yeah. I'm gonna talk about that a little bit later.
Yeah, no, Johnny, honestly, with all the research I've done and everything that me and Glitter have looked into, what was it? It was like, type 4?
There's a 13 different, EDS.
Yeah, but I think yours fit most closely to, type 4, which has, like,
I don't remember that type. Like, the names are so, like, hard for me. Because they are not in Phoenician, you know?
Type 4 included your, POTS and your, mast cell activation disorder.
Yeah,
so,
maybe...
like, it just made a lot more sense.
Yeah, but yet again, I'm not a doctor. I can't,
Yeah, but your doctors don't even recognize it, so we have to kind of guess.
Yeah, but still, I am not the doctor, so I would recommend still going to see the doctor if you need more specific.
Yes, but we were specifically addressing your type.
Yeah. So for me, I don't really know what it is, but for my paper saying it's in a hypermobility, but all my signs and symptoms not add up with it. So yeah, because I have more than the going on what it comes with the EDS. So the hypermobility doesn't really add up fully, but that's how I'm living it because I do not get anything else. Okay,
Yeah, that's why it's been so hard to get her any treatment.
yeah.
Why she had to come over here to get a little bit of treatment.
Yeah, I want America from some treatments and stuff like that. And the next one, did you? Yeah, you read this. No.
Yep, I read the whole thing. Okay, so signs and symptoms. This group of disorders affects connective tissues across the body, with symptoms most typically present in the joints, skin, and blood vessels. However, as connective tissue is found throughout the body, EDS may result in an array of unexpected impacts with any degree of severity. And the condition is not limited to joints, skin, and blood vessels. Effects may range from mildly loose joints to life-threatening cardiovascular complications. Due to the diversity of subtypes within the EDS family, symptoms may vary widely between individuals diagnosed with EDS.
Yeah.
Yeah.
So that means every EDS patient is a different.
Yep.
And like I say, it's hard to describe EDS, like because everybody have different, and everybody feel every symptom differently. So it's
Pretty much the only consistent thing is like that it affects the joints in one way or the other, and you have stretchy skin.
yeah, and chronic pain.
Yeah, to different degrees depending on the version.
So, yeah.
So, musculoskeletal. The
Muscular.
Yeah, this is why I'm saying.
Yeah. Yeah, this is why I have
Musculo-
nightmare because I do not know how to say these things.
Musculoskeletal symptoms include hyperflexible joints that are unstable and prone to sprain, dislocation, subluxation, and hyperextension, which is why Glitter literally will play a video game, and while she's like tapping the buttons, sometimes you'll hear a pop and then her having to pop it right back in.
Yeah, and sometimes it's just your fuck shit, perkele, ow! And that's me dislocating something while I play games.
Yeah. I've. Oh boy, I remember when you dislocated your spine. That was.
Yeah.
That was bad.
The one thing what I'm most scared is if I ever dislocate my neck, because that is really, really bad.
Yeah,
Yeah.
well, I remember because when you dislocated part of your spine, you lost use of one of your legs for a while.
Yeah.
So that, yeah.
The dislocation has to be painful. Yeah, you can try. If you want to know, you can try.
Okay.
But all I'm saying, it's really, really painful.
As a result of frequent tissue injury, there can be an early onset of advanced osteoarthritis, chronic degenerative joint disease, swan neck deformity of the fingers, which is it's basically when the fingers do that weird
They locking.
bend.
The fingers get like locked the different ways.
Yeah,
I have that. That's why that's why I have the most expensive finger braces ever, and I lost everything.
Yeah, you know when in elderly people their fingers they start to curl instead of being straight anymore, and it's usually because their fingers get gnarled and their joints get all fucked up. That's similar. Snake neck deformity specifically is even more severe, but it happens. Of the fingers and boutonniere deformity of the fingers. Tendon and ligament laxity offer minuscule protection from tearing in muscles and tendons, but these problems still persist. So that's like the only benefit. you're a lot less likely to sprain a muscle or a tendon because they're a lot more stretchy.
Yeah, but still the muscle ache for weak muscles is bro.
Yeah. Deformities of the spine, such as scoliosis, which is curvature of spine, kyphosis, which thoracic hump, or tethered spinal cord syndrome, craniocervical instability, and atlantoaxial instability may also be present. Osteoporosis, osteopenia are also associated with EDS and symptomatic joint hypermobility, which basically means all along her damn spine could snap, crack, bend, or deform permanently at random times.
Yeah, that's why I'm sometimes scared to sleeping.
Fair. There can also be myalgia, which is muscle pain, obviously, and arthralgia, joint pain, which may be severe and disabling. Trendelenburg's sign is often seen, which means that when standing on one leg, the pelvis drops on the other side. Osgood-Schlatter disease, a painful lump on the knee, is common as well. In infants, walking can be delayed beyond 18 months of age, and bottom shuffling instead of crawling occurs. So, baby Glitter shuffling around, dragging herself like a dog, scraping her butt along the ground.
That actually facts.
Yep.
I have a video about that when I was a baby, and I literally I look like, you know, the Cowan chicken.
Yeah.
And there's this red dude who jumping with the butt. I look like that.
Mm-hmm.
I can't. Okay. Next one.
Okay. So, for skin, the weak connective tissues cause abnormal skin. This may present as stretchy or in other types simply be velvet soft. So, yeah, Glitter's skin is basically baby butt smooth and stretchy as a rubber band.
Yes,
So...
my skin is so soft, and even if I didn't use a lotion, it's still not soft. Smooth like a butter. Yes, my skin is smooth like a butter, and you can stretch it like beyond, and it doesn't even hurt. It's just look a little bit weird. You guys gonna see pictures later on about some stuff. I put it couple pictures, and I put some memes and stuff. So you guys can see later things what might be a little bit disturbing for someone.
In all types, some increased fragility occurs, but the degree varies depending on the underlying subtype. The skin may tear and bruise easily. That's for sure. You breathe.
Picture of what?
You literally bruise if somebody
tickling you
gently brushes against you.
Yeah, I got bruised like when someone tickles me. But picture of my knees, my hands, yeah. There's a picture about me, bro.
Yeah, a little bit.
And my cat is one of the pictures too.
then some of the memes.
Yeah, there's a lot of memes. I want to put in some memes and some EDS related pictures. Yeah.
So the skin may tear and bruise easily, may heal with abnormal atrophic scars. Atrophic scars that look like cigarette paper are a sign seen including in those whose skin might appear otherwise normal. In some subtypes, though not the hypermobile subtype, redundant skin folds occur, especially on the eyelids. Redundant skin folds are areas of excess skin lying in folds. Yeah, you never had that, but I do know. But when you do heal, you get scars.
The scar is like big.
Yeah. Other skin symptoms include molluscoids, pseudotumors, especially on pressure points, petechia, subcutaneous spheroids, libido reticularis, and piezogenetic papules are less common. In vascular EDS, skin can also be thin and translucent. In dermatoporaxis EDS, the skin is extremely fragile and saggy.
Yes, Kitsy. If you threw pans at me, I get bruises. But hello, Kitsy. How you doing? Welcome.
It depends on how hard, but yeah.
But yeah, I get really easily bruises. KO! KO! God dang it.
So, let's see. The cardiovascular symptoms are thoracic outlet syndrome, arterial rupture, valvular heart disease such as mitral valve prolapse creates an increased risk for infective endocarditis during surgery. This may progress to a life-threatening degree. Heart conductive abnormalities when found in those with hypermobility form of EDS, dilation and or rupture aneurysm of ascending aorta, cardiovascular autonomic dysfunction such as postural orthostatic tachycardia syndrome, Raynaud's phenomenon, varicose veins, heart murmur, heart conduction abnormalities. Basically, your heart's fucked.
My heart is fucked. Because half of this thing I already have.
Yeah, basically.
But yeah. Okay, next one, because the signs and symptoms keep going on.
Yeah, signs and symptoms are basically like...
GG's, I know, right? The signs and symptoms just keep going on. It's longer than my Santa Claus wish list when I was a kid, okay? So here you go. Ay. I tried to sue the airport for losing my luggage. I lost my case. I hope.
Unfortunately, I don't think that works.
It's joke. It's the joke because he lost.
Yeah.
Now I got the joke. This time I got the joke.
Yeah, I am saying I don't think that joke works all that well.
But I got it this time. I got it this time, and yeah.
Hey, one in a row.
Yeah, I think that's a win. I think that's a win. This time I got it.
Hey. This time, the goldfish meme didn't actually come true.
Yeah.
But okay. Damn it. Urogynecological. Weakened connective tissues can lead to pelvic organ prolapse in female patients with Ehlers-Danlos syndrome. Natal female patients may also experience voiding difficulties, frequent urinary tract infections, and incontinence due to structural abnormalities. Pelvic girdle pain is also frequently reported. Menorrhagia, dysmenorrhea, and dyspapuremia are common symptoms associated with Ehlers-Danlos syndrome and are often mistaken for endometriosis. Excessive menstrual bleeding can sometimes be attributed to inappropriate platelet aggregation, but faulty collagen leads to weakened capillary walls, which increase the likelihood of hemorrhage. In case of pregnancy, patients with the EDS are more likely to experience complications during parturition, postpartum hemorrhage, and maternal injuries such as sporadic pelvic displacement, hip dislocation, torn and stretched ligaments, and skin tearing can all be linked to altered structure of connective tissues. Basically, you don't want to have a baby if you have EDS.
Yeah, it's even to carry the baby is super dangerous for the baby and for the mother. You shouldn't see any horror movies today. It's May Friday 10th. Oh, today's a May 10th. Not the 13th, though.
This time you
boom.
didn't get it. May
No, I didn't.
frighten you. You know,
Nah.
it may frighten you.
Ah.
Yeah.
Basically, hips trying their best to lie. Yes.
Wait, what? You didn't get it either? God damn it.
The hips lie a lot. All I'm saying, if someone say that hips don't lie, bro, they lying to you because hips lie a lot. Okay, just saying, this looking in the hip, not good. It's hurt like a motherfucker. Just saying, just saying.
Yeah, I was there. Boy.
Okay.
Like, I'm just glad you haven't had another, like, nightmare scenario like that in all the rest of the years.
Yeah.
Okay. And then gastrointestinal. Research suggests a correlation between connective tissue disorders such as EDS and both structural and functional problems within the gastrointestinal tract. Which is most likely why you have acid reflux and other problems.
Eating and food is so complicated, and I don't even know how to talk about the thing because it's so triggering for myself. Ayo, Gargin, how you doing? You welcome. Because, like, food is super complicated, and I have love-hate relationship, and it's getting towards for the hating part because it makes me sick, super sick. Yeah.
Hey, you know, there was a time when it was even worse. I mean, it got a lot better, and then it got worse again.
Yeah, so
it's... I still remember when I first met you, and you couldn't eat a single thing without, like, needing to throw it up, like, not long after.
Yeah.
The only thing keeping you alive back then was the fact that there were a little bit of food particles that stayed in your body and got processed before you had to chuck them up.
I checked your symptoms on the internet, so I know about this. Aw, that's so nice! Oh, ta-da! But yeah, so yeah, food is... that's the reason why I do not eat when I'm streaming, because, yeah. And food gave me more complicated, so I do not like eating in the stream. Only starting Sabatons, and after when I meet, I always have to do the BRB scene because, yeah. Because, I don't want to get banned from Twitch. Because nowadays you can get banned from POV. Even for the sound. Yeah, even for the sound, yeah. I've seen many times. But yeah, next one off. That's what the happening to be. And the silence continues. And it's continuing.
So, here we go with the next group. Inflammatory problems. High incidences of coexisting inflammatory disorders, such as correlation between connective tissue disorders and the development of such aforementioned conditions. Inflammatory bowel diseases, such as Crohn's disease, ulcerative colitis, and celiac disease are more common in EDS patients when compared to control groups. Of note, patients who are already diagnosed with inflammatory bowel have separate but not totally confounding etiologies: eosinophilic esophagitis, an inflammatory condition characterized by allergic type reactions to various foods and chemicals, and extensive esophageal remodeling. It is 8 times more likely in patients with connective tissue disorders when compared to patients without. Ugh.
That was a no word monsters, and hope you're okay. I'm gonna talk about a little bit more because I got a message from my doctor a couple days ago, so I really need to talk about also that afterwards.
And then your functional problem.
Yeah,
Func-
that's it's an error. My functional
Functionality.
it's an error.
Functionality, a small bowel dysmotility, delayed gastric emptying, and delayed colonic transit are commonly related to EDS. These changes in transit speed within the gastrointestinal system can cause a host of symptoms, including but not limited to abdominal pain, you got it. Bloating, you got it. Nausea, you got it. Reflux symptoms, oh yeah, you got it.
Yeah.
Vomiting, you got it. Constipation, no.
No, that's a rare for me, but diarrhea, bro.
Diarrhea. Goddamn poop.
Okay, dumb question. You can walk right. Not as much.
Yeah, over the years, it's
I got
worse.
my rollator from my early 20s, and before that, I walk with those walking sticks. What is it called? Those arm sticks. What they call in English? I don't know. Not cane. Not cane. Not cane. The crutches.
Walker?
Yes, crutches. Crutches. Yeah, I walk with those, but because I was 60 when I got my diagnosis, so I got super late my diagnosis. I've been had all the symptoms and stuff since I've been born, so I was 60 when I got my diagnosis. So all the physiotherapeutic help what I needed, I never got it.
No, actually, you're born with it.
Yeah, because you're born with this illness. 16 is pretty late, and all the critical help what you need is when you're a kid.
Yeah, if you're going to stop a lot of the worst symptoms from showing up, you gotta attack it when they're a kid.
Because that's why for my coordination with my limbs are super bad. Because my joints over hypermobilities, and because I never used to have braces, it's super hard me to use braces because my limbs are be used to have so more range of a mobility, and that's bad. And if I put braces on, I have braces for you guys gonna see the picture of my braces later. But I can example, I can't wear the braces full day because they start hurting because my joints been used to different type of movement. So all the critical help which I needed, I didn't never get because you needed those when you're a kid, when you grow up, because then your body attachment for new thingies are much easier and they growing as used to those thingies. So yeah,
your hand is really freaking out.
Yeah, I don't know why, bro. Maybe it's a ghost in my room, bro. But hello, Smashingy. Hello, how you doing?
Smashing man. But yeah, Cowgirl, there are no dumb questions about this.
Yeah, there's no dumb questions, only dumb answers by Glitter.
Oh yeah, it's a EDS, Ehlers-Danlos syndrome.
Hold up, I can pull it up again. The thing. The people who came late. Here. It's called Ehlers-Danlos syndrome.
They can all see your folder.
Yeah, I know, it's fine. There's nothing secret.
I know, but I was just saying. But yeah, it's EDS, Ehlers-Danlos syndrome.
So yeah.
But yeah, Cowgirl, so the whole walking thing is complicated. Around the house, she's still able to walk. But outside, it's mostly either a rollator or whatever. For a while, she had to use a wheelchair.
I have a wheelchair.
Yeah. Well, she has the wheelchair. And if she has a wheelchair available, it's a lot less draining on her legs. Like, if she goes anywhere for a long period of time, like out and about for a long period, she kind of needs a wheelchair.
Yeah.
Or somebody to push her around
Yeah, cause
on her rollator.
the pain of the legs gonna be, cause they getting super fast tired, and the pain, dude, the never-ending pain. Cause I live in chronic pain. That means my pain is 24/7. It's never stopped. It's always there. So sometimes I wonder, people, how you guys know you guys are alive because you're not pain? Because I will be scared if nothing's been pain anymore. I will be like, am I dead now? Nothing's pain anymore? How you guys do that? Ah, that's easy.
But yes, finishing up. The finishing up this page, some studies also suggest problems with the liver, which is in large part responsible for bilirubin conjugation. Although research in this area is sparse, patients with joint hypermobility were found to have higher rates of indirect hyperbilirubinemia than control groups. Possibly why you had liver failure a while
Yeah,
ago. Although, that being said, I have a bunch of other reasons you possibly had.
No,
liver
the thing
failure.
is that alcohol has nothing to do with my liver failure. Cause literally, when I had the
I
stomach,
always thought it was the medications.
but it's the medications and EDS and mixed. Which is bald? No, I'm not bald. But I used to be half bald. Because the medicines make my hair losing. So yeah, I was.
Yeah, but it all grew back.
Yeah, I was lucky that they grew all back, but it was still terrifying and scary thinking my life when you woke up and your freaking hair's on the freaking bed. And when you go to shower, they are training to the thingy.
Thankfully, like over the years, you kind of figured out some mitigating factors, ways to be on a little bit less medications while also
Not anymore. We're getting back, bro. We're getting back, bro.
Yeah, I know. It's getting back that way because they can't figure out what the fuck is wrong with you lately. But they are different medications than before. So
and the sinus symptoms continuing.
Yep. So, structural problems. Basically, you have very bad.
And autophagy, yes, it's a chronic disease, and we're gonna later come for that part too.
Yeah. Structurally, changes within the musculature in the intestine, such as increased elastin, can lead to increased frequency of herniation. That's pulling the muscle, basically.
Yeah.
But either way, laxity of the phrenoesophageal and gastrohepatic ligaments can lead to hiatal hernia, which in turn can lead to commonly reported symptoms such as acid reflux, abdominal pain, early satiety, and bloating, all of which you have.
Yeah.
Internal organ prolapses, which at least you don't have, and intestinal intussusceptions occur with greater frequency in patients with weakened connective tissue. The autonomic problems.
I have it all, bro.
Yeah, basically. No, I mean, some of the symptoms you don't have at this point, thankfully. Like, although neurogastroenterological manifestations in connective tissue disorders are common, their root cause is not yet known. Splanchnic circulation, small fiber neuropathy, and altered vascular compliance have all been named as potential contributors to gastrointestinal complaints, particularly for patients who have a known comorbid autonomic condition.
And the sinus symptoms continuing. It's forever.
God damn it. Neurological. which explains why you're fucking crazy. And a goldfish.
I'm not crazy, but I
Um,
can mean I'm not feeding a goldfish, okay? Okay, but I'm not crazy.
nah, you're pretty crazy.
Bro, I'm not.
I would say.
You are crazy, bro.
I'm friends with you. I have to be crazy.
No, I'm
You're
more serious
crazy,
to
too.
drink today because I'm sad. Why you're sad? Don't be sad. Easy.
So, neurological, chronic headaches are common in patients with
Yeah, that's
EDS.
annoying.
Yeah, you had the worst migraines back in the day, I remember.
I have the Horton disease. And it's called suicidal, suicidal headache. I have that, yes.
Meh. Whether related to dysautonomia, TMG, muscle tension, or craniocervical instability. Craniocervical instability is caused by traumas to the head and neck areas such as concussion and whiplash. Ligaments in neck are unable to heal properly, so the neck structure does not have the ability to support the skull, which can then sink into the brainstem, blocking the flow of
Reason why I have a
cerebrospinal
neck
fluid.
brace.
Yep. Which in turn causes autonomic
Because they
dysfunction.
have so heavy brains. I have big brains, so I need a neck brace because my joints can't support my head.
No, you gotta do the old Daria quote. My head is too big. That's because it's so full of dreams.
Big brains is hard. Oh, you have a cold time to play it, bro. I'm dying. Jojo head, yes.
Except she doesn't have the biggest head either. It's just too heavy for her fucked up structure.
It's just don't cut me out. Don't cut me out.
It's like what are those the Chinese buildings built out of the paper mache painted to look like bricks?
I have no
And they
idea what
just, like-
you're talking about, you know.
In China they build buildings out of material and they paint them to look like bricks, but they're like this very fragile substance that'll crumble in your hands. And that's why they have buildings that just fall down all the time.
So you say my joints are paper?
But paper mache is a little bit different than paper.
Oh,
But
like I said, I have no idea, zero knowledge what you're talking about, you know.
it is very weak. Let's just say that. Arnold-Chiari malformation is also more frequently found in patients with ES because of the instability at the juncture between the skull and the spine. This causes herniation of the posterior fossa below the foramen magnum. Increased pressure created by the malformation can lead to a flattened pituitary gland, hormone changes, sudden severe headaches, ataxia, and poor proprioception.
I really like a popcorn.
Yeah.
I don't know how buddies from my dyslexia has rated popcorn.
You have poor popcorn.
Poor popcorn.
Ophthalmological manifestations include nearsightedness, retinal tearing, and retinal detachment. Keratoconus, blue sclera, dry eye, Sjogren's syndrome, lens subluxation, angloid streaks, epicanthal folds, strabismus, corneal scarring, brittle cornea syndrome, cataracts, carotid cavernous sinus fistulas, and macular degeneration. Thankfully, the ophthalmological manifestations of EDS did not really show up for you.
I do not understand what that means.
It means your eyes aren't super fucked up. You no. Come on. You have big eyes, but you don't have tearing and scarring in your eyes.
Okay, listen. That's the thing about I was a kid. They thought that I have super something is wrong with my eyes. So I have to when I was super teeny and tiny. So I have to went to eye doctor and they've been done stuff. So I've been had problems with my eyes. But
Yeah, but I mean, most of these symptoms don't show up for you, thankfully.
yeah.
Because you'd be basically completely blind if
Yeah,
you had,
I'm not, but I still have been had some problems. I don't know the name of the problem what I had.
No, see, that's the thing. She has glasses,
I have
but she
glasses.
doesn't need them.
I need them, but I don't use them, and I be lost them.
Yeah, well, she gets along without them. The same as me. Like, my doctor gave me glasses years back. I don't use them. Because...
But I actually have eye problems, but I just don't know the name of in English, and I don't even, to be honest, I don't even know the name of it in Finnish, because I was teeny tiny. So yeah. But continuing.
Yeah. Audiological complications may also occur. Hearing loss is common. Maybe that's why you never
Actually, I haven't that.
Maybe that's why you never listen to me. Huh?
Yeah, maybe, but yeah, my hearing is not good enough anymore. I've been noticed also that my other ear not hearing as goodly than this other ear.
So, hearing loss is common, both conductive and sensory neural, and is most often bilateral. Autosclerosis and instability of the bones in the inner ear may also contribute to hearing loss, which is probably why you also are so clumsy.
Yeah, I am clumsy because this thing. Yes.
Sure. Why not blame that one for it now?
Yes, chat, you guys need to talk a little bit louder so I can hear you, chat. But currently, chat, I know sign language. So that's good.
Okay. So, I think we're up to the last page of the signs and symptoms.
Yeah. It's hold up. I just need to my music. Okay. Last page of a sign of symptoms.
Yep. So, other manifestations, which are separate from all the laundry lists we've already seen.
Yeah, I didn't want to, because these are like, I don't know how to explain, but it was like way too much typing if I will be in specific type everything.
I gotcha. So other manifestations: hiatal hernia, gastroesophageal reflux, poor gastrointestinal motility, dysautonomia, Gorlin sign, which means you can touch your tongue to your nose.
Yes, I have to put that up. Sorry, I have to put that because it was so funny.
Prolapse, flat feet, tracheobronchomalacia, collapsed lung, nerve disorders, insensitivity to local anesthetics, dental problems including gum disease and enamel hypoplasia, platelet aggregation failure, mast cell disorders.
I have that.
You got
mast cell activity disorder. I have that. But yeah.
Let's see. Pregnancy complications, a uterine tearing or premature rupture of membranes, hearing loss may occur in some types, and there's some evidence that EDS may be associated with greater than expectant frequencies of neurodevelopmental disorders such as ADHD and other learning, communication, and motor issues, including autism and Tourette's.
I have ADHD.
Because it is often undiagnosed or misdiagnosed in childhood, some instances of EDS have been mischaracterized as child abuse. The pain may also be misdiagnosed as behavioral disorder or Munchausen by proxy, and the pain associated with EDS ranges from mild to debilitating.
Yeah, I have, when I was a kid, in the middle school, we have the nurse appointment. Every boy and girl have the nurse appointment in the middle school, you know that? Yeah, I have a story about this. Like, real life story. Um, um,
Yeah,
I...
because
Hmm?
but just to quickly, because easy, like child abuse, because if your kid shows up all the time with fucked up joints or bruises all over their body, everything else, for a normal kid, that's not normal. Especially if there's not a good reason or sign for why they're covered in bruises, like an easy explanation. So a lot of times, because EDS sufferers, their joints are popped out, twisted, broken way, way, way easier, or they bruise from just a slight breeze, or hell, Glitter gets bruises all over
Can
her
I
body.
tell my story
Just,
now?
yeah, just from rolling around in bed at night. Like, that's, yeah.
Okay, for when I was in middle school, I have a real life story about this. Middle school, there's a time when every boy and girl need to go to the nurse office to all they check up how much you weight and how much you've been grow and just talking about you and see your eyes and ears and whatever the basic examas. And I used to play a football. Soccer. Is it a soccer in English?
Yeah, you mean, yeah,
'Cause
it's
a
soccer in English, but like football.
Yeah. And I used to play a lot of football because I was in the football team. So I was bruises all over me because I played football from free time. And I was pretty active when I was a kid, even with the pain. I wanted to be normal. Okay, I wanted to be normal. So
Well, you also thought it was normal that
yeah,
everybody-
I thought that everybody's in the pain all the time. That's I was adult when I knew that it's not normal. I was like 21 when doctors say it's not normal. And I was like, bro, what the fuck? But yeah, I went to the nurse and I have to take my clothes off and I was like almost butt naked there. I have my undies. And she looking at me, looking my arms and my legs, looking at me. And she asking, where did this come? And I was like, I am in the football team. And I play football and we had a tournament. So I was playing football and she was like, nah, nah. Who do this to you? And I was like, I played football. And she was like, no. Someone has to do this for you. And I was like, no, I played football. And I didn't understand how all the bruises could not come from the football. And they called my mom and dad and they thought that, yeah, it was a huge thing because the nurse thought that they abused me and hitting me and stuff. And it was a huge thing. And the real story that I was literally just playing football. So yeah, it was, yeah, it was scary and it was, yeah, it was yeah. The nerve has been hella panicking. Yeah, I don't know. It was, yeah. There's a lot of weird things what I've been had because my illness and because other people's not gonna understand my illness, and this is one of them. But at the same time, I did not have yet my diagnosis because I just get my diagnosis when I was 16 and I was like what 9, 10 when that happened. So yeah, that's yeah.
Like, because I know what you look like, because I've seen pictures of you from that age group, I can just imagine little Glitter being like, I was just playing football. Vita Satana.
Bro, Vita Perkele.
Vita Perkele.
So yeah.
Shut the fuck up! I was playing football.
Yeah, but I was confused. But I was also shy as fuck that time, so I would not talk that way for a teacher. And Finnish people doesn't talk about teacher for that way. That's more American thing, I guess. I can see because how kids talking to teachers, and in Finland, nah, that's not nah. You're not talking that way.
Yeah, that's why kids in Finland actually have to learn things. Imagine that.
Yeah, I was really confused. Like I said, I was 21, and I needed my better pay medicine. And I asked about doctor about the pain because I could not understand yet how pain works and like why I having it and stuff like that. Even I have the diagnosis already, but nobody really talk about it for me. So I was curious in asking it, and I literally asked my doctor like, hey, are you in a pain? What type of medicine you using for your pain? Cause this pain I can't deal with anymore. And then the doctor was like, Glitter, sit down, take a breath, and you are pain because you're EDS, and all healthy people not having pain like you. Healthy people not in the pain when they walking. Healthy people are not when they walking doesn't go clickety clackety clock rocks box when they walking. It's just because you have this illness. So yeah, I was 21 when I knew that pain is not normal. I thought it's normal. I thought that every person in this entire world having a pain like I have, but it was not true. It was not true. So yeah. Okay, next page. Carl says, I don't know if we have to really read this thing.
Yeah, I don't need to read it all of it, but there's a very important part right there at the top.
Yeah.
Every type of EDS except for hypermobile type.
Can you eat anything or you have a problem with food as well? I have a lot of problem with food.
Yeah.
And there was a time that I couldn't eat at all.
Yeah, we worked on that. I kind of...
Why you say we?
Because... No, I mean, when I first met you, you had a lot of different problems, and I remember we looked into things, and then you went through those ideas. But I remember...
but still, I done in it, not we.
Okay, you did it. I gave you some of those ideas for you to do whether or not you were going to do
like this, try to get the respect for my illness.
You know what? You didn't even know what a probiotic was.
Yeah, I don't.
But introduced the idea of maybe it could help.
Yeah, but now it's not helping you, so
Yeah, I know. Well, that's because you have an antibiotic every couple, every couple weeks lately.
But yeah, food, like I say earlier, food, I have a love-hate relationship with the food, and there's actually one time of period that I was 6 years almost, I did not eat at all red meat. And it was not like, yeah, I'm a vegan now. It make my stomach so much pain if I eat beefs or something like that. It was make my stomach so much pain that I did not wanna eat it anymore. And so yeah, and one time I could not eat nothing, so I got these medical smoothies. I call them smoothies. They're not smoothies, but they're these medical thingies what you're drinking if you can't eat solid food. And bro, don't taste so bad. Even if it's chocolate, it did not taste like a chocolate. I didn't expect to see someone stream about something I suffer from. Oh, I suffer that. I have an ehlersdanlossyndrome syndrome. But hello, Domi. Hello, welcome. Nutritional shakes. I think those are the real name, but I call them smoothies.
Yeah, it's basically one of those all vitamin shakes that you have to get. It's like one step up from having to stab yourself with a needle and intravenously get all your vitamins and minerals. But like I was saying, the important thing on the top there for Glitter is that every type of EDS except hypermobility type have these genetic variations, and here's the issue. Because in Finland they do not recognize anything but hypermobility, she was never able to get any of the proper treatment
Yeah.
because since hypermobility doesn't have these genetic variations, they didn't recognize any of the symptoms or any of the things as like diagnosable problems.
Yeah. Because ehlersdanlossyndrome is something that I've been diagnosed with along with the scoliosis and stuff. Welcome to the club. I have ehlersdanlossyndrome syndrome and bunch of other shit what comes with it.
Mm-hmm. No.
Hold up, I just adding more drink to my drink.
But yeah, Autoboto, she was basically just on her own most of
Yeah,
her
I
life,
do not yeah, I do not get that as much.
Well, it's mostly the fact that they don't even recognize any other form of EDS.
But that for the
Most
hyper
likely
indie.
because it'd be a lot of work to help someone with a rare disease, and
I'm gonna put your name. I'm sorry, but I'm finished. Domigoroshi, thank for the follow. Welcome to Kenyos, welcome to Kifu, welcome to StarArmy. Hello, welcome. Come. Okay, you read the causes already. Or did I?
yeah, basically I was just saying that because honestly, it just talks about the variation genes in people with EDS, and to boil it down, instead of reading all these random like numbers and letters nobody's going to really pay attention or care about, the basic idea is think about all your joints and think about the fact that we have padding between those joints, and like your nose or your ears, they're also made up of a thicker than just your internal like body material. All of these things, like your earlobes and your nose, like the hood of your nose, and the padding in between your joints are made of collagen.
Thank for the gifted Soppy Bobby for Dummy! Thank you, holy moly!
Kizi_Kachi
Oh,
my body's broken. It's getting late, those dingies.
Always. Always cut.
Nice cut there.
Perfect.
And Lucky, thanks for the lurking key. Remember, take a snack, siren, and pissing key. It's important. I didn't see the comment over. I did eating. See, now it comes to your following. My body's broken. Twitch, what the fuck? Twitch, what is Twitch? Stop.
You were saying you weren't going to have this much stuff?
That's not on me. That's on Twitch, bro.
Oh, okay. Yes, I got you.
Do I have still? How many is disease?
But 1 sec. Jeez, I was trying to
Yeah,
explain.
I know.
So all that material that's in between your joints makes up your earlobes and the hood of your nose and all that good stuff. Basically, it doesn't function. Like the body, like Glitter's body and people with most forms of EDS, other than the hypermobility type, don't produce collagen correctly. There is a malfunction in the
coding of the process.
Yeah, in the
And
coding of the
that's why-
process to produce it.
And that's why my pose is this way.
Yeah, so it's why her joints are rounded instead of like mostly put into sockets with padding to keep them stable. It's why collagen is also what holds your internal organs in place. So it's why a lot of internal organs have problems in EDS patients, because there's almost like a webbing of
They have a
collagen.
dance party there inside of it.
Yeah. There's almost like a webbing in a normal person's body. The webbing keeps all your internal organs in place at all times where they're supposed to be. They're a lot more fragile and a lot more like flimsy holding them together properly in EDS patients, which is why you can get injured super easy.
Yeah.
especially in terms
But
of
people who always be like, why you sound like that, Glitter? This illness is because that's why I sound like an adult toy. This is the reason. There's no, what do you call, voice box, out of
Yeah,
voice
basically her vocal
changer.
cords are just as stretchy as the rest of her body because of EDS. So her vocal cords literally vibrate at a much like a stretched out, rubber
Yeah.
band.
My
Sounds with a
vocal
higher.
cords are like weird. So yeah,
I mean,
that's why he's adorable. Get to go home, Inky. I'm not adorable. I sound like a duck toy, and because I have my allergies, because the pollen season started in Finland, I sound like a broken duck toy. But I've been accepted the fact that I'm sound like a broken duck toy sometimes, and sometimes I'm a duck toy. But I've been cool with it.
okay. So skipping past all the scientific jargon on
Yeah,
that,
that
since
I
in the
just wanted to
collagen.
put there, but I didn't. Assuming that we're gonna go in there because I'm not professional,
Yeah.
Dr. Ringy.
So I'll move right down to the bottom of it. Most forms of EDS are inherited in an autosomal dominant pattern,
Oh,
which means
oh yeah. I thought that you're gonna. Oh, the
no. It's
diagnosis.
the end
Okay.
of the
Okay.
causes.
She sound like the small face. Latina. I'm not Latina. I'm a Finnish. Perkele.
Which means only one of the two copies of the gene in question must be altered to cause a disorder. A few are inherited in an autosomal recessive pattern, which means both copies of the gene must be altered for a person to be affected. It can also be an individual, de novo, or sporadic variations. Sporadic variations occur without any inheritance. So basically, what that means is that to get EDS, only one parent is required to have the gene for it and pass it on. But the thing is that a lot of times it's mostly passed on by mother, like mother to a daughter or a mother to a son, because for some reason the mess up in the genetic structure happens typically along the mother's side of the genetic component. Don't know why, but it's a thing.
Yeah.
That's what EDS is so much more common in women, and that's why.
Yeah. And most of if you are male, most of the time EDS doesn't even you don't have as severe case. And most of the EDS patients who are male doesn't even know that they have an EDS because they doesn't show any symptoms at all.
Though the ones that do end up with severe cases that are male usually tend to have a pretty bad time because it's even worse getting treatment for them because they're even rare. They're a rare case among a rare disease.
Okay, next page.
Yes.
Is a diagnosis diagnosis.
Okay.
Tako na Taringi. Okay, see you later, Dummy, and have a wonderful day, Ingy, night, morning, wherever you're all. Good time zone, Ingy. And here, you find me here. I'm gonna be here. Just here. I'm not gonna move. Just here. I'm not gonna be here. I'm gonna be here.
Over there.
Well, I'm not gonna move, Ingy. I'm not gonna move.
Okay. So. Yep, you too. Have a good
See you later. Bye-bye.
So let's see. A diagnosis can be made by an evaluation of medical history and clinical observation. The Baton criteria are widely used to assess the degree of joint hypermobility. DNA and biochemical studies can help identify affected people. Diagnostic tests include collagen gene variant testing, which that
I didn't
very
get that.
rarely happens.
I got
Yeah,
the
well,
Bennington. I got the Bennington, and I got the 9 out of 9. So I in Finland it's rare even have a 9 out of 9, and I got 9 out of the 9. So I got all the points for it. So
Yeah,
they didn't do me nothing else, and they just give me EDS. The EDS.
yeah. Well, the thing is that they're never going to actually
Yeah.
do a genetic testing. Those things are way too expensive for Finnish medical system to bother with.
Yeah.
Collagen typing via skin biopsy, echocardiogram, lysyl hydroxylase or oxidase activity. But these tests are not able to confirm all cases, especially in instances of an unmapped variation, because literally EDS comes in just about all shapes and forms.
Yeah.
Honestly, Anna, that idea would actually make me laugh a bit. Although I'm doubting that $50 would cover a plane ticket to anybody's place.
You can't even get in Lapland to capital city of Finland to $50.
Yeah, that's true. So, continuing on. So, clinical evaluation remains important. If multiple members of a family are affected, prenatal diagnosis may be possible using a DNA information technique known as linkage study. Knowledge about EDS among all kinds of practitioners is poor. Research is ongoing to identify genetic markers for all types.
$50 will be only covered the tax rate for the airport, bro. You guys have a cheap taxi then.
Yeah.
I'm like, dude, you guys have a cheap taxi if you pay $50 to the airport.
Although, actually, now that I think of it, the stories about that you've told me over the years.
What story?
This is even funnier, where it says, if multiple members of the family are affected and a prenatal diagnosis is possible, but it was only because you got diagnosed.
Yeah, then my mom got it.
Then they found out that your mom had a slightly less, a less severe version.
Yeah, my mom got diagnosis because of me. So yeah.
So instead of her mom having a diagnosis and then figuring out it got passed down, it was Glitter's version of EDS is so fucking bad that they figured she had it, and then they're like, well, where the hell would it come from? And then figured out, oh, her mom has had it her whole life, so I guess that explains it.
Yeah.
So, differential diagnoses. Several disorders share some characteristics with EDS. For example, in cutis laxa, the skin is loose, hanging, wrinkled. In EDS, the skin can be pulled away from the body but is elastic and returns to normal when let go. Marfan syndrome, the joints are...
It feels like I'm from The Incredibles. The mom. No.
Mm-hmm.
The Elastic Girl from The Incredibles. I'm like that! The mom is rich as fuck. The mom with the booty. Yes!
Yeah,
that
indeed.
mom with the booty.
In Marfan syndrome, the joints are very mobile and similar cardiovascular complications occur. People with EDS tend to have a Marfanoid appearance. Tall, skinny, long arms and legs. Spidery fingers. That doesn't make any sense. So you don't have the Marfan look.
Okay, I have some of it, but they are not like my legs. But my fingers are super long. My toes are super long. Even I have small feet.
You have super tiny, yo.
Yeah, but
So
the thing is that if I will be a healthy person, my fingers will be not as long they are now. Like my hand is small, but I have super tall fingers compared to my hand. So that's the part of the Marfan syndrome's physique. Now, is it nah?
But here we go. But physical appearance and features in several types of EDS also have characteristics including short, large eyes.
Okay, listen.
Appearance of a small mouth and chin due to a small palate.
Listen. I have really fucking big eyes.
That sounds a lot more like a Neko Satan I know.
Listen,
Short, large
listen.
eyes and a small mouth and chin.
Listen. I know that I actually look like in a real life anime girl. I like dude. I have super small mouth and my chin is super small, but my eyes are fucking giants. I literally, when I was a teenager, I just called myself I look like an alien. But then my friends, nah, you're just real life anime girl.
Yeah. So, the palate can have a high arch, causing dental crowding.
I do not have as much crowding, but I have I don't know.
also had to remove one.
Yeah, but that's not the case. That's the puking.
Yeah.
But I used to have braces because when I was a kid, because my mouth inside of my mouth was too tiny, so they tried to make it bigger. So they tried to stretch my mouth. Oh yeah.
Blood vessels can sometimes be easily seen through translucent skin, especially on the chest.
Yeah.
The genetic connective tissue disorder, Loeys-Dietz syndrome, also has symptoms that overlap with EDS. In the past, Menk's disease.
Oh, it's saying chest, but you can see all my veins, almost every on my body.
Yeah.
And when I take a hot shower, I sometimes look like green because all my blood vessels are like getting popped out. So yeah. But you can see them on my chest or my titties. My boob on my chest. Yes.
It's not probably as bad as
Glare
are imagining, because the imagination does a lot worse than reality. But yeah, basically you can see veins through her skin a lot easier.
That's why doctors, when I have to do the blood test, they be like, "Oh, you have an easy veins," and no, they are not easy veins. Even they look like, cause you can see them straight, but nah.
Yeah, it's kind of like when you go and they want a blood test, they go, "Oh, look, that vein is bulging. I can see it so clearly," and they're like, "Yeah, that's a great one." That's on a normal person. On Glitter, you could literally look anywhere on her, and it's like very easily where you can easily tell where the surface veins are, even if they're not that great to get at.
Yeah.
Which is why you needed the butterfly needle when they took blood here in the States.
Yeah.
Thankfully, they listened to us too, because here they're like, "Yeah, her veins are gonna be really tough. Let's use this right off the bat." And there really wasn't any trouble. It wasn't like when you take a test, or they need to take blood over there in Finland, and they just jab your arm.
Yeah, I'm like a needle pillow. I'm like a needle pillow.
Pin cushion, yes.
Butterfly needle, yeah, it's a type of needle what they're using if you have an example cancer, when you're because cancer make your veins
shrivel up.
Super and tiny and like dry. They have to use this type of butterfly needle that they get the blood out of the veins if they need a blood test.
Yeah, like have you ever seen a needle that has kind of like two sides that are rubbery on the side of the needle, and they look like two loops, and they call it a butterfly needle. But either way, yeah. Cause you've never seen it. See, I knew all about it because they had to use that with my mom after her cancer.
Google it. Mr. Google
Yeah.
tells you.
Yes.
Yeah.
Basically, when a vein is way too thin or difficult to deal with, butterfly needle goes in and it helps. It helps stretch like the vein, basically get it in there and not break it, so that they can actually just remove the blood like normal. Um, they had to go in through your hand knuckle though. That was not fun.
Yeah, that's like a motherfucker. But yeah, it is what it is.
Yep. So in the past, Menkes disease, a copper metabolism disorder, was thought to be a form of EDS. People are commonly misdiagnosed with fibromyalgia, bleeding disorders, or other disorders that can mimic EDS symptoms. Because of these symptoms, because of these similar disorders and complications that can arise from an unmonitored case of EDS, a correct diagnosis is important. Pseudoxanthoma elasticum is worth consideration in diagnosis.
So yeah, and because of I have EDS, and they literally say they back in days they make it as an bleeding syndrome, the bleeding disorder, because my blood doesn't clotting. My blood doesn't clotting at all. So yeah. So yeah, it's a bit of a problem if I need an surgery or something like that. Yeah, it doesn't clot at all. At all.
I mean, the way that you're saying it makes it seem like you can't heal ever. So it does it. Your blood does clot. In all
if
fairness,
I have my nose bleeding, I need ice and lot of towels and just waiting forever. It's super painful to waiting because it's start pain in my nose.
Yes. So it does clot. It just either...
So if I have to go to surgery, I'm bleeding freaking dead. There's no dude, there's
Like
not
any-
it's a fancy way to saying that. If I have to go to, if I get a car crash and I'm gonna have a huge wound, I'm gonna be dead. Just saying. If I have a teeny tiny wound, if I cut my finger with the scissors, it's bleed a lot, but of course it's healing. But now I talk about if I need a surgery or car crash or accident. So yeah.
Yeah, you gotta be careful with the necosade.
Oh yeah.
But either way.
Okay, next one.
So here's the thing, Autobot. The thing is that because she bleeds so easily and so fast, even if they had her blood type, it'd be
I
very
just bleed it out that.
Yeah, she does. It basically, she would bleed out too fast, or she just wouldn't stop bleeding. So they'd literally require an entire hospital's worth of blood just for her.
Who you saw blood? It was a glitter.
Yeah. And I don't even know if a body would hold up to that much
No,
circulation.
it will not.
Yeah, her veins would probably not.
Yeah, she's a special person. Yeah, I'm so special that I use all of the hospital's blood.
But yeah, so no cure for Ehlers-Danlos syndrome.
You didn't say management. Management first.
Yes, management. Manager. No. Autobot. The clotting happens based off the platelets within a human body. Blood is held together by the platelets in a person's body. So while yes, she has the blood, the actual platelets that cause the blood to clot together to catch them and create the barrier are still gonna come from her body. it's one of the misconceptions. So clotting happens because a separate substance within the body basically bonds the blood vessels together, like the blood together, and creates the clot. If her body can't do that properly, that's why she bleeds so much in the first place. And it won't matter if she gets new infusions of blood; her body still isn't going to have the clotting factor, you know.
In my case, the plasma doesn't help.
Yes, like there's the plasma, and then there's the platelets. If the platelets don't react to your plasma correctly, like the new plasma. No, okay. I'm trying to explain it. So basically, the blood clotting, the ability for the blood to clot, isn't actually in the blood itself.
It's in your body system,
Yeah, your body produces platelets. The platelets basically create, upon a wound, almost a web type of web thing that the blood is then going to get caught on. When all the blood builds up on the web, it stops more blood from coming out. That's your, little, that's your scars, that's your scabs. Those are dried up because the blood was stopped in place by the coagulated mixture of blood and platelets. If she doesn't have the correct platelet and clotting factor, then no matter how much blood, or if it's somebody else's blood, it's gonna end up just flowing through, you know?
Professor Nightmare. Yes. Okay, another. The managerman.
Yes.
Management.
No cure for Ehlers-Danlos syndrome is known, and treatment is supportive. Close monitoring of the cardiovascular system, physiotherapy, occupational therapy, and orthopedic instruments. Yes, like I said, it was platelets. But yes. Close monitoring of cardiovascular system, physiotherapy, occupational therapy, and orthopedic instruments, wheelchairs, braces, casting, may be helpful. This can help stabilize the joints and prevent injury. Orthopedic instruments are helpful for the prevention of further joint damage, especially for long distances, and people should avoid activities that cause the joint to lock or overextend.
That's why I have to stop being a gymnastic. I was super good for gymnastic.
Yeah, but here's the problem too. She's so bad now because for the majority of her life, she had no help.
Yeah, I did not have help at all.
Yeah.
And
when she did get any help, it was so expensive. Like, each hand for braces was like, what, 2,000 euros?
Yeah, 2k euro one hand. And now you have a two hands.
Yeah.
Sometimes so 3 hands.
In the Finnish universal system, they don't really do medical devices.
It was a joke. It was a joke. It was a joke. It was a joke, okay? I have to light the mood. I have to light the mood, okay?
So, like, yeah.
She's a mutant. Maybe. I feel like that way, okay? I feel like that way because my illness.
But that's also why her wheelchair was bought out of country and then sent in, because they don't have those, those types of wheelchairs, and any wheelchair that you get in Finland is going to be like 4 times as expensive. So, yeah.
Yeah.
If it wouldn't cost 10 times more to send it, we probably would have gotten it from America, in fact, because it's even cheaper here.
I do not know because
But-
I never look in English.
Yeah, either way. A physician may prescribe casting to stabilize joints. Physicians may refer a person to an orthotist for orthotic treatment, which is your braces. Physicians may also consult a physical and/or occupational therapist to help strengthen muscles and to teach people how to properly use and preserve their joints. Aquatic therapy promotes muscular development and coordination. I remember that shit. Oh my god.
What?
So, no. So, we almost.
Good, you should learn block bending from the avatar. Baby.
We almost saw you get the water therapy.
I got it. I
Like-
was.
You were there for like a couple visits.
Okay,
and
listen,
then
listen.
COVID, and
Listen,
then COVID
listen,
happened,
listen,
and then
listen.
canceled it all. And then after those places reopened, they forgot all about you.
Yeah,
So-
listen. I got,
Fucking.
listen. I got the aqua therapy and it was super nice. And they even make the place that I can go because I am allergy for what do you call? Chlorine.
Chlorine.
Chlorine. Yeah, chlorine.
Yeah,
So they
the-
make the place that I can go there. So they make the place special to me. And I got it like 10 times. Where I went to like 3 times. And then COVID happened. And everything shut down in Finland. So they called me like, sorry, Twitter. The pool,
Everything's canceled.
the aquatherapy is cancelled because the COVID. They can't provide your healthiness and because your condition you're not you can't come. And I was like, girl, what the fuck? So yeah, and then after when COVID we reopened, they never called me back. And to be honest, this point my health is so crap because what is going on at this point. I am way too tired to battling yet again for the aquatherapy. I'm way too tired, so nah.
Like, and back when you first started, like when I first met you, you were still able to do a lot of the physical
Yeah,
therapy.
for the now, I bet I can't even do that anymore.
Yeah, because like if that kept going, but so much fucked up stuff happened.
Yeah,
and
I don't think so. My legs will. It might be help a bit, but it might be also be too much also at the same time.
Yeah, it probably would be. Like, okay, so just to let you guys, like, show you guys how fast her condition can degrade or get worse in very short time. When I first met her, she would walk all the way to her buses. She would hop on. She would ride half a city away or whatever to get to a physical therapist and go for like an hour almost doing exercises with a physical therapist, get out, hop on another bus, make her way back, grab something from a local like store, like corner store, and then go home. And all of this by herself. She couldn't even imagine doing that nowadays.
I can't.
Yeah.
And that's why when my dad have to go to the emergency surgery, I have to cancel all my doctor appointments because I was not able to go there. Because the snow and stuff, but still it's way too far away from me now.
Yeah. And this is like roughly only about a little less than that actually. I'd say you stopped being able to do that type of stuff about 3.5 years ago.
Yeah,
or so.
about 3 years I would say.
Yeah. So like for the first couple of years I knew you, you were able to be a lot more active.
Yeah.
You got yourself in a lot more trouble back then, but you it wasn't for lack of try.
Hmm.
But beside the point. So, aquatic muscular development and coordination. With manual therapy, the joint is gently mobilized within the range of motion and/or manipulations. If conservative therapy is not helpful, surgical joint repair may be necessary, which is also not a option for you
Yeah.
because of your
That's
other problems.
the surgery one is for the people who doesn't have as severe EDS than I have.
Or they have a version that doesn't include the
The
blood problem.
Yeah.
Yeah,
But because
like
I have the
mast
blood
cells.
problems and mast cells and everything else, nah. Like, I can see that my mom was able to give, if she ever needed a surgery for her joints, or if she accidentally been in a car crash or something, I will see that they can able to do, because my mom is already been many surgeries already, and she been always fine. But for me, nah. Nah. So if I ever need some surgery for my joint or whatever surgery, it's gonna be a tough place to choose. Do I really need it? Is it something worth to risk my life? Or no?
Both. Okay. Medication to decrease pain or manage cardiac, digestive, and other related conditions may be prescribed to decrease bruising and improve wound healing. Some people have responded to vitamin C. Medical care workers often take special precautions because of the sheer number of complications that tend to arise in people with EDS. Or
Dude,
not.
I just drank and I'm almost dying and you just keep talking. Bro.
Well, I didn't. You were just. I'm used to it.
Yeah, I literally drank and it was wrong throat, bro.
I'm used to it.
You're used to me dying on the stream. Thank you, bro. Thank you.
I'm literally used to hearing you, like.
But you just keep going. Okay.
Did you want me to get through this?
Yeah, I wanna, but you win as Twitter. Are you okay?
Kitty, I could not be her friend for as many years as I have without getting used to it. Because every day you get used to certain things going on, like her joints all popping out and her yelping a little bit, putting them back
I like that white.
Or her having to throw up right after.
Sorry, I have to put my finger back in place.
Yeah, or her having to throw up after eating sometimes because her digestive system fucks up. You can't be like, oh my god, she's doing this, or oh my god, this is, you know.
Yeah, it was my finger. It was my left pointy finger. Middle joint was dyslexic.
Like
dislocated, not dyslexic. My eyes are dyslexic, but my finger was dislocated halfway, so I need to pop it back.
Like, if she actually had any real major issues, it'd be a lot more severe than that, and you guys would all be freaking out, and then I'd be like, oh yeah, maybe this actually is a problem. Well, you know.
Dyslexic, so the dislocated reading. That's how I feel, yes. Could have slowed down the versions. This is a good part. Nightmare be like, bring the popcorn now. Bring the popcorn now.
One day. But yeah, no, this thing says medical care workers often take special precautions because of all the complications. Yeah, not in your case. In your hospitals, they don't give a fuck. Because 99% of the people who read your chart have no clue about, like, most of what is said on there.
Yeah,
and they're just like,
they Googling you when I go to see doctor.
Yeah. It's kind of a roulette wheel of whether or not they're going to, you know, do anything properly.
Yeah.
In vascular EDS, signs of chest or abdominal pain are considered trauma situations. Again, nobody's ever questioned you on that one.
Yeah.
In general, medical intervention is limited to symptomatic therapy. Before pregnancy, people with EDS may be recommended to have genetic counseling and to familiarize themselves with the risks pregnancy poses. Children with EDS should be given information about the disorders so they can understand why they should avoid contact sports.
Yeah, this I mean! Nobody told me nothing! And when I,
Or other physically stressful activities, like
when
most of the stories about your
and when I
childhood.
get my diagnosis when I was 16, the doctor was like, one day you're gonna be in a wheelchair. Good luck, and that was all.
Yeah.
And I have to research everything by myself. All by myself. Na, 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 na. So
Yeah, then like a couple of years ago, they even told you that you probably would never walk properly again, too.
yeah, but to be honest, it looked like that way, Ingy.
I mean, yeah, but I remember when your leg went out, they kind of just gave up on.
Yeah, because they
figuring
didn't
out
know why. They didn't. Okay. 2020. No, yeah, 2020. Summer I was in a hospital. Full summer almost. Because my back was all wonky and dislocated, and because I'm used to it, I put always my joint back in place when they because I'm used to it. Okay. And then my leg went fully numb. My left leg went fully numb. And I couldn't move it. I sighed. I did not feeling it. My left leg didn't have feelings at all. And I went to the ER. And they was like, okay, we take some pictures of it. And then I ended up in months in the hospital. And still this day, they doesn't know what the fuck was wrong with that leg. But
Yeah, and
gladly,
I annoyed the fuck out of you.
Gladly, with my own physical therapy, what I researched on the internet, I got my feeling back and walking some sort of way back. You clip at your spinal nerves, putting it back in. Yeah, I think so. I don't know. Like I say, I don't fully know what's happened because the doctors doesn't know either. So I still don't know what happened. Is it the bad leg? Yes, it's the bad leg. And in that day, it's just getting better.
Yeah,
And it's still getting better. And to be honest, bad leg, both my legs are bad.
Yeah, but the one that swelled up with water first is the one that went.
Yeah.
No.
It's my left leg is literally collecting water like in a water can. And it doesn't.
That's why I think that it might be related. Because
I don't know, because now my right leg doing the same. So I don't know.
Yeah, but I think it may have started from that. That's all I'm saying.
Do you have 3 legs or 2? We can talk about that after stream.
But Kitsy, personally, I always thought it wasn't that she clipped her spine. I think that her lower spine and her hip popped out of place, and then when she popped it back in, it pinched a nerve, like the main nerve that goes down to the leg. So that's what happened. Instead of it clipping her spine itself, because I feel like if it clipped a disc, not a herniated disc, because I feel like if it was a herniated disc or it clipped part of her spine, below a certain point would have gone numb, but it was only one leg. So I feel like when she clipped it in, like that main nerve that goes down the side of your leg, ended up getting pinched. Like the circulation got clipped at some point, and so it lost.
Well, I do not know. I am not the doctor. You're not the doctor, and my doctor doesn't know either. So I'm not gonna speculate.
They didn't bother. So of course
but
we have.
You're speculating now. Thing is, what Irene doesn't know what is right and what is wrong.
I know neither of us do, but because your doctors never bother doing anything.
Yeah, they did not, and
we guess a lot.
but still. stick to the facts.
Stick to the what if we stuck to the facts, nobody would know anything about glitter anymore, like at this point.
But at this point it is. Nobody knows nothing.
Fair.
That's why I need having a lung picture soon. They have to get pictures of my lungs.
The thing is that we had to fly you came here for vacation.
Yeah.
But while you were here, one of the major reasons you were here was because I got you into an American doctor so that you could get diagnosed with edema, so that they could treat the water building up in your leg, so that you
but
weren't
still they did
confined
not.
completely
Doesn't.
to
It's
it.
just a symptom.
It's a symptom of something greater, but yeah, the diagnosis is at least leading
But
to the
okay,
doctors over
you
there
need
having
to
take
move
it
on,
seriously.
Ingy.
Yeah, no, okay. Let's finish this up.
Because we are not busy the pictures. Bro, the pictures are golden.
Gotcha. So in general, medical intervention is limited to symptomatic therapy before pregnancy. Okay. Children with EDS.
You read that already.
Yeah. Emotional support.
Emotional, damn. Okay.
Along with behavioral and
Okay,
psychological
hear me
therapy
out.
can be
Hear me
useful.
out.
Support
Hear me out.
groups
Hear
can
me.
be immensely
No,
helpful.
Bear doesn't hear me out.
I'm saying, just let me finish. We got like 2 sentences. Helpful for people dealing with major lifestyle changes, poor health. Family members, teachers, friends should be informed about EDS so they can accept and assist the child. Okay, that is everything. We are done with the listings. Say what you want.
Like, bro, I get an ad. Bro, what the fuck? My music get ad. No.
Hey, I'm gonna BRB though, because I need to go to the bathroom real quick, and I have for a while. What we were talking.
Hold up, bro. This got
What?
starting. I got freaking ad.
Oh my god. Well, while you're scuffing it up,
Yeah,
I'm
I am
gonna
stuffing
go
it out.
to
I'm
the
waiting.
bathroom real quick.
I'm waiting the ad going
Okay.
away. What the fuck?
Okay.
Okay. Go.
Okay. BRB.
Okay. Now I have the music there. What the fuck? Wait, bro. Why they have to put ads everywhere? Asking for friends. We love this stuff. Yes, we love the ads. We love the ads. But what comes? Oh, is the ads? Yeah, bro. Okay, what comes from the emotional support? I used to have emotional support for EDS because I had a friend. But sadly, 3 years ago, my friend who had EDS too died from a complication from the EDS. And she was same age as I am. I was, and yeah. So nowadays, I do not have emotional support for EDS because I don't really have friends who have an EDS anymore. And yeah. Sometimes I just feel lonely, I guess. But I feel like every people sometimes feel lonely. Loneliness. Aw, that could have that kitty. So yeah, I used to talk with my friend a lot of because we had same issues with the EDS. Even she was from Australia. Australia. And we used to talk a lot. And I got a lot of help from her because she got a lot of help from the Australian healthcare. So when she got something, I was no thingies to ask from my doctors. The loneliness can be so bad that it feels like drowning. Yeah, it's sometimes the loneliness is bad, and the depression, anxiety, what comes with this illness. At the same time, I started being a VTuber, and I feel like it's been helping me a lot. Like with my loneliness, I do not feel as lonely anymore. Phoenix Dog don't finish things properly, huh? Yeah, they not. They not. But it is what it is. I'm kind of used to it at this point of my life that things are not good with the Finnish healthcare with their illnesses. like it's good healthcare if you have like common illness, but because I have so rare illness, it's hard. It's hard with the thingy, but yeah. That's why sometimes like, and because the Finnish culture is a bit different, and that we kind of suffer in the silence, so it doesn't open up thingies. And IP used to not talk about thingies, all the shit thingies. That's why, like, my streams, I just want to bring positive vibes, and positive makes it almost harder, yeah. Like, we are, like, silent sufferingies in Finland, and that's part of our culture. And, yeah. And that's why, also, some games are super hard, like, hard to play. Even it's funny and all from all the jokes like skill issue and stuff like that, but my main reason why I really struggling with the games is because my hands are really bad and the pain. Because my hands are pain 24/7 and I need to be careful that they doesn't dislocate it all the time. So yeah, that's also part of why things are a little bit hard. What do we have next? Oh yeah. Now start the meme party. Now start the meme parts and the picture of EDS stuff. And this is the literally after listening couple hours about EDS, I feel like you guys can relate this meme now. I think you guys can relate this meme now. Because this is how this is this is I felt when I first time like being back school, yeah. This is I felt when I first time heard about EDS and I researched everything about it. Bro, I can relate this one. This one, bro. And then we have hold up. These are not gonna come in the place because I forget putting them. Okay, let's go. Let's go my personal picture first, and then we can go back to the memes. I'll be back once I do some research and stuff and get more beer and my useless friends. Okay. Here comes my fingies. Oh, you're wrong button. Here comes my fingies. Here's my fingies. This, bro. I love to do that. You will be funny. You love it. I'm not allowed to know. But have wonderful beering me. You just play on the hard mode. Yeah. This is the reason why games are hard for me. These literally explain why my gaming is what it is, bro. if okay, I have to do this joke. They ask you what you want to be as an adult. I say I can be a traffic triangle. I can be a traffic triangle. And hello, Yak. I have to. When I grow up, I gonna be in a traffic triangle. It's they pay good, bro. And I can sit on my wheelchair ringy. And I can sit on my wheelchair ringy. Okay, but you got that point. I guess. Okay, next glitter picture. Hold up. Next glitter picture. Why it's so small? Here's the skin. You can actually stretch my elbow and get that way. Like, dude, my skin is so stretchingy. And then it's getting back in place. So like I say, It's a loose skin. It feels like my skin is like LSD girl. Yeah, and it feels like I have. You're laughing for one piece. I am not. But you can what do you call? The stretching and it's bending back, and it's soft and smooth. Let's say that way. Let's say that way, Ingi. So yeah. What else I was saying? Oh yeah, it's sometimes annoying. Example, when I put my wrist braces, my hands getting. Oh, hold up. I will show a picture if I have to explain what I mean. Cause like, dude, do I have the picture? I do not have. God dang it, I forget. Oh well. Here comes another picture. This is I have nail polishing. I have nail polishing, but yeah, I play games this way. This way I play games. My fingers, I play this way games. That's why I have an emotional damage and struggling against skill issue. Yet again. This is like ehlersdanlossyndrome gang. Get it twisted, yeah. It's so funny to make that. So yeah, my fingers are pretty fucked up. My fingers are. You played Twister with the one hand, yes, and I'm winning it. There's a reason why people doesn't want to play Twister with me, okay? I am overpowered. With the Twister playing. Okay, what next? Oh. Here's my cane. I have pink camouflage cane with the Hello Kitty. And it's cute. It's awesome. It's I love it. I love it. It's so cute. The pink camouflage. Of course. Yes, of course I have Hello Kitty. I need to be happy. For the game. But I can't see. That's the game. That's the game. Can't see. Bro, are you blind? Because they come. God dang it. God dang it. Come back, dude. Dude, you got me, bro. I was like, dude, are you guys blind? It's there. God dang it. God dang it. Okay. Bro, that was mean. That was meaning it. That was meaning it.
What was me?
What? What do you say?
What was me?
Because I saw my camouflage cane and Chell was like, we don't see the cane. And I was like, it's there. Are you blind? And they said, I can see it. Because it was a camouflage, bro. Here comes something more trigger warning. Here's my knee. It's a video. 1 second. Are you guys ready for my knee? Are you guys ready for my knee? Cause dude, I have sexy knee, bro. Look at that knee.
Knee reveal.
Knee reveal. That's a sexy knee, bro. But look at it. It's kind of bendy though. It's a bit of bendy. I can put. If you see, hold up. See, if you see my finger going inside of my knee. Look, it's literally going inside of there. A bit, yeah. It's a bit, yeah. So if you actually see it's my finger going inside of my knee. So yeah, it's reasons why yeah. And then we have other video. Hold up. It's my nails. That's what I'm saying. Glitter's a bit small. I'm not a bit of small. I'm a bit of a giant. And here comes my nail. I'm not tiny. And And here comes my nailing game. The nail, dude, it's a bendy. My nails are actually super bendy. And here's also my finger braces. So yeah. My nails are super bendy. Everything on my body is a bendy. it's a super bending.
Yeah, her braces are all lost at this point.
And yeah, I did lost my. Hold up. What next? I don't know what you guys wanna see. That's my problem in here. Oh yeah, this one is kind of important. Here is your collagen on your body. This is mine. It's so fucked up. That's why my skin is stretchy. Because all these collagen thingies. So yeah. You have lost zebra in your collagen? Yes. Zebra is Ehlers-Danlos mascot. That's why the ribbon is a zebra, black and white ribbon. So yeah. Also, when people ask me, have you taken your meds? Yes. Here's my meds. I've been heavily medicated. So yeah, these make me survive day by day. Imagine that. I have more meds than my 85-year-old grandma. But it's fine, I guess.
And that was a reduction.
What it mean?
Less meds than you had before.
Yeah, I do not have a picture of my old ones, but this is like, yeah. And I get it more and more now. Because shit is going down. Then here is also because I have bad heart problems. This is heart oxygen, the oxygen of the blood. It should be 95. So that's why, because it's 78 sometimes, I need extra oxygen. I have to have sometimes the extra oxygen from the nose thingy, you know, the nose canals. And this is my rest heartbeat sometimes because the heart going fast. I'm gonna go fast. So yeah, I have a bit of a heart problem in here. That's why I remember when I started being a VTuber, people asking why you doesn't wear the heart monitor, and I'd be like, nah, there's a reason. Because my heart is not the way it should be, and the number can be all over the place. It doesn't work the same way as in a healthy person. Heart always racing, yeah. So yeah, that's a bit of a... That's why I have this thingy. I need to monitor, go brrr, yes. That's why I need to monitor my heart sometimes. And that's why I also have a lot of heart ultrasounds and stuff like that. So they gonna checking up how badly it goes and stuff like that, so yeah. What next? What next? Here's my old wheelchair with my cat. Here's Eddie. Here's Eddie. He loves sleeping my wheelchair. This is my old one. It was manual and it was heavy as fuck and it was too big for me.
Yeah, but you did make it all tassely.
Yeah, I put the pink thingies on the wheels, but still. The best is the house, yes, I know, right? So yeah. That is, even now, the new wheelchair. It has a kitty, yeah, it has. And the thing is that, even now, the new wheelchair, what I got, They sleeping on even that one. So yeah. Oy, oy, oy. But yeah, here's my braces. Here's my wrist brace, my knee brace, my ankle brace, my neck brace. You pimped your ride? Yes. I pimped my rides. Even the new one, I'm gonna pimp it. And I've been, I have picture of my old, walker. It was blue one, and it had lights. I have picture of my old walker. Yeah, I'm a fucking Oh, hold up. I'm gonna show my big chunky boy. I call him a big boy. Hold up. I pull up big boy. Here's the big boy. And I call him a big boy because look at that chunky monkey. And it's like walk like a Terminator. Da, da, da. So yeah. That's a Gundama food. Yes. It's a real Robocop Furingi. So yeah, I have it all. I have it all. But hold up. I have the old picture of my old... See here. This is my old walker. I put lights on it. I put lights on it because in Finland, this picture is from outside. This is actually outside. This is the reason why I put lights on my walker and walkers, because it's dark as a bakpolingi in the nighttime, not nighttime, winter time. So I put lights so nobody gonna drive over me. Yeah.
It's not that they go through entire times of their year where there's no sunlight 24/7.
Yeah, so that's why I put in the lights. The battery, it had the battery thingy, and yeah. I have it that. Hello darkness, smile from me every freaking November when it starts. So yeah. What else? I have so many pictures, and to be honest, some of it I do not know if I can even show it, because they might be way too graphic from Twitch TOS. I did not read from Twitch TOS for this one. But here is something. Because I'm living in the quick English is hard, okay? But because I'm living with the chronic illness, I feel a lot of killed. I literally feel killed because I can't spend as much time with my friends. Yes, I have friends. If you didn't know, I have a friend. But now you know, I have friends. But I feel killed.
I don't know about
no,
that. I might be a figment of your imagination.
But the guilt is super hard to dealing with sometimes. And it's because I don't spend time as much with my friends. I can't cultivate huge life. What do you call? Like, huge life...
Events.
Events, yes,
Parties.
events. Like parties, like weddings, most of the part, weddings and hydrain, next to hydrain, and stuff like that. So yeah, it's a bit of a boomer, but and like I say, sometimes it's loneliness because I watch every my friends' live events just through social media. Oh, the wailingy. And then we have everybody who always asking me, so when you're getting better? Never. I can't. Because people doesn't really understand what chronic means, and chronic means that it's never go away. So it's always funny when people asking like, when you get better, and I was like, Never. Ay. So yeah. And then, oh, bro, this is my superpower. I swear to God, this is my superpower. Did you know people with joint pain can predict rain because the barometric pressure drop when storms are approaching? Old injuries and arthritic joints may not adjust to the pressure change, and when the soft tissue and fluids around the joints expand, it irritates the surrounding nerves and acts a pain. So, I have specific pain when it starts raining or storming. So I know I am the real weather woman. I am the real weather woman. Some people are hard to understand. Yeah. This is relevant to me as well. Oh no! You are the weather dude also. No wonder my pinky finger hurts. Yes. If you have some type of joint injury, it's bro. So my body knows, and the thing is that my body went like kind of this shutdown mode, that I'm just getting tired as fuck. Like I getting passed out tired because the pain and stuff when it starts raining or storming. Dude, it's hard. And it's sometimes hard when I'm streaming and that's hitting it's bro. My knees are in the storm coming. Yes. 6 things about chronic pain you didn't know you knew. Pain is exhausting. You may not have constantly realized it, but the pain that has recently nagged you throughout of the day has drained you as bad as any flu. That's why I'm tired as fuck all the freaking time. The pain made me so exhausting, and the fact that I can't get proper resting because the pain. So it's annoying, let's say. It's pain in my badongadongi. Pain causes poor sleep. You will think that if after a long day of fighting with the constant pain, sleep will be in a great recipe. Unfortunately, this is just a dream. Pun indeed. Just a dream. The pain is the pain. Facts. The pain is the pain. Pain make you cranky. I don't know. Making me cranky, but sometimes yes, sometimes yes. Chronic pain sufferers aren't all just cranky buggers by nature. Pain drains you physically and mentally. But I have dreams about my pain. God dang it. Imagine seeing dreams about your pain. Dude. Pain kills your how do you say that? Concentrations. Most chronic pain patients fight like a crazy to live normal life. They try to ignore the pain and go about their days, but it's just not that easy. Yeah. I try my best to be like normal and try to do normal things, but it's hard and sometimes dangerous. Pain damage your self-esteem. Yes, facts. You can't do what you want to do with your time even when you try, and it seems like everyone is mad or unhappy with you no matter your effort. Yes. This illness, EDS, been eat all my self-esteem. That's why you guys, when you call me cute, I genuinely, I do not feel cute. Because the fact is that my illness been eating so much of my self-esteem. And yeah, it's super complicated. I don't know even how to explain it. But yeah. Pain causes isolation. When you're in a constant pain, the last thing you want to do is attend to company party, the neighbors' backyard barbecues, or even small gathering with your closest friends and family. Yeah, it's facts. That the reason. Also, one reason why I feel lonely is because I isolation myself from people, and we understand, but the actual true fact is that you're just like go home and you get sick. I am not cute, bro. I am not cute. No, no, not. Oh, find me, okay? I roll over your toes. I roll over your toes, like, dude. I'm zooming and rooming. Your toes are flat. They're gonna be flat as like pancakes, bro. Oh, this is my old ehlersdanlossyndrome thingy. I lost it somewhere, but I have new one. Someone in my community bought me a new one. Thank for the person who gifted my throne new one, but this is the old one. Cause when I moved back to home, it's went losing this somewhere. I do not know where it is. Cause you need to have the medical thingy because I have the EDS. So if I need an ambulance, they need thanks gifter. Yeah, thanks for the gifter. I don't remember who it was because it was long time ago. Cause like I said, I don't even remember what I ate yesterday. But I need to have the medical brace. So if something happens, so people around me know that I have an EDS, or if the doctors or the hospitals or the nurse and stuff like that knows that I have an EDS. Feel of chronic pain. You never know what comes next. No energy, flare, migraine, fatigue, nauseous, yeah, frustration, bro. It's a bit of a mix everything. And in fact, if you ask me this question, I don't really know how to answer. Because it's everywhere, I guess. I feel like there should be more arrows on that wheels on pay. Yeah, it just... I just took the picture on the internet. But like, if you ask me good or where it hurts, I don't understand the question. The question is... Cause it's whole body? It's whole body to hurt? So, yeah, that literally you mean I'm only supposed to hurt only at the specific place? Yeah, that's literally... Yeah, dude, nah. Nah. And this is how... Literally, my illness, literally... You look me, I'm happy and positive and I look like the flower. But my inside, bro, I look like this. I look like actually this, and even now, even more because all the health shit what's going on. Oh yeah. And I'm the one that brought the present of your turn. Really can see, like I said, I don't remember. It's like a year ago or something like that. But thank you if it was you. It was 18 months ago. It's over a year ago, bro. And like I say, I do not remember what I ate yesterday. So, so yeah. But yeah, I battle against my body. That's. I think you guys knew it already. That's type of situation, Ingy. I feel you. Thank you. I've been sick for so long, some people seems to think I should be used to it. What they don't understand is that it doesn't get easier, it's just getting more exhausting. Yes. People... Yeah. This is the reason why I feel lonely, because people doesn't really understand my illness. And now when my friend is not here and sadly passed away from EDS, it's hard. Because people doesn't really understand. am a wimp. If I don't complain, I'm a liar. If I cry, I'm a make a drama. If I stay silent, I'm a crabby. Let me tell you that I'm no wimp. I'm no liar. I don't make a drama, and I'm not crabby. I'm just pain. Pain. Without love, pain. Can't get enough. I look rough. So
You
yeah.
also are a pain.
Yes, everybody else. But that's my day job. Being a pain in everybody else badonka donkeys. Just saying. So yeah. Yep, that's right. I am sick. Not just any sick, but good old-fashioned chronic sick. And just like it means back in day, today it still means forever. I'm not gonna get better by following an exercise routine or some special diet or some clean shit. It's not fun or cute or glamorous. It's not fancy or exciting, and no, it's not awesome. Just sit at home all day. Yeah, I'm still jealous people who go to work. I am still jealous. It actually is somewhere in between terrible and horrible. It's scary, it's boring, and you are literally watching days drag by. Everyone's around you move forward while you are just simply stuck. Yes. And the worst part came. Burning, itching, stabbing, sharp, dull, aching pain. So please tell me again that you love this rich place, cause I sure will. You can go work with me. What you working? I don't even know what you're working. So yeah. Imagine that. Autotech. I do know nothing about the Autotech. Heavy lift, bro. Only what I lifting in rare cases is my badonga dongi from the chair.
Definitely can launch me across the room. I know that for
but like it's like something. This summer, Quentin Tarantino digs up a record number of his actor from the Netflix and puts them in limits wide in the latest overcrowded delusions. Ayo? But it always be. Doctor says what type of pain sharp or do all type of all of it. Facts! Facts, that's me. That's me. Okay, do I have something else here? Yeah, this one. You want it. New feet, new ankles, new knees, new hip, new shoulder, never mind the new body. I want the new fucking body. I have to put this on the throningy. I need a new body. I need
builder.
I need a new body, full body. Just second hand shopping, not enough, yeah. Imagine that, Angie. A sharp duel, it's a pain, who cares? Pain without love, pain. Oh yeah, this one too, bro. I've been here this so many times. You're in chronic depleting pain. I would like some painkiller to make life tolerable. Sorry, those are addictive. Try some adults. Yeah, I can't get enough pain management. What I need, and it sucks. And it sucks that I suffer because doctors be like, nah, you're too young. They are addictive. You're not gonna get them. And I'd be like, dude. So yeah, I suffer because doctors are kind of like maybe a little bit too harsh who get those medicines and who any medication can make a doctor logically tolerable. Yeah. I need that. It sucks. It sucks. But yeah, when it comes we talk about the hair loss. I was truly half bald one time. I was half bald for one time of my life, and it was scary. I hate it. My self-esteem was super low, and every morning my hair just was on my pillow on my bed, and when I went to the shower, the freaking tiles and everything was just full of hair. And I used to have thick hairs, but now they are kind of thin because all that what happened. So yeah. But it is what it is, I guess. I'm glad that some of it grow back and I'm not bald, but they are a lot of thinner than they used to be. Well, I always be bald to you. I know, right? I know, right? What next? What next? I don't know. Maybe this is the last one. This is the last one. What's your wish this Christmas, Akir? Every year I just wish that they find some type of cure for EDS. And maybe I'm teeny, I don't know. I really hope it, but I also same time know that if they ever find it, it's never gonna be in my lifetime, Inky. But you can always hope, I guess. And
we have to shove you in one of the CRISPR machines.
and hope is what keeps you going, I guess. Dreams and hopes, everybody needs those. But yeah, I guess. And I don't know if you guys want to see videos. I have videos about EDS, but I don't know. Do you guys want to see them or no? Because we've been talking about this already now 2.5 hours. And that's what they had letting you can see. So I don't know if you guys want to watch the videos or do you guys want me play the Stardew Valley. I don't know if you guys been bored. That's the thingy. Videos, okay, videos.